We recognize that we have a problem that we have to work together collaboratively to tackle in our city, across the metro area, and the state of Colorado.
Denver recently hosted the first Fentanyl Action Summit, which brought local and national public health experts together to address the complex range of issues dealing with the fentanyl crisis.
Fentanyl is the worst drug crisis of all time. Really, no pill and no powder are safe now if you've gotten them on the black markets.
An opioid is a narcotic, pain-relieving medication that can also produce a euphoric effect, and we know that they're also highly addictive.
Fentanyl is really strong, and it's not a drug that people can just experiment with and have it be okay. We have a 2-day summit about fentanyl and its effects on our community. We brought together experts in many different fields, including harm reduction, recovery, treatment, and prevention. And we're just trying to get everybody talking and networking and presenting some great new material on how to tackle this problem in our city.
Really, the goal of the conference is to save lives and show people that everyone has a role in that. We have to have partnerships to address this issue because it's so complex, whether that's treatment providers, community-based organizations, government, even citizens of Denver coming together to address the issue. It's going to require everybody.
Good morning, everybody. Thanks for being here. I'm excited to be here today to moderate our panel on education and awareness, a discussion about communication and resource needs in different communities across the state of Colorado.
The main thing I'm trying to do when I talk to people is raise awareness about the fentanyl problem. And there's so many different aspects of it, where it comes from. I kind of specialize in the China reporting about how fentanyl originates in China, goes through Mexico, comes to the US, but also how it's distributed, how it's used, and how the problem is addressed at all levels. For procedures like open heart surgery, it was really a revelation. But the problem is that for the same reason it's good as a medical drug, it's bad as a drug of abuse. It comes on quickly and fades away quickly, meaning that users, when they're addicted, have to re-up over and over again.
So some of the things we're talking about are strategies to improve access to treatment. Mobile units can be used, or funding can be used to help increase the number of providers so we have more people going into treatment and hopefully achieving recovery. Harm reduction strategies and destigmatizing are also being highlighted here.
Just briefly on opioid side effects. So, like I said, it's a narcotic, pain-relieving medication, but it also slows your physiology. So it leads to things in the body that would be the result of that slowing. So constipation and nausea are some of the most common symptoms of the gastrointestinal slowing. But the most dangerous would be respiratory depression. So opioids act on receptors in our brain that trigger us to breathe. And when there's an opioid there, it slows it down, and that can slow it all the way. And so someone can stop breathing, which can lead to death. Or better yet, if you have Narcan, you can reverse it. Narcan's an opioid antagonist that restores breathing functions by blocking the effects of opioids.
Carrying naloxone, carrying Narcan is an effective way to reverse an overdose. If you see somebody that you think may be having an overdose, you can administer Narcan and call 911. It's not going to hurt them, even if they're not having an opiate overdose, but it can save their life.
I think the biggest challenge with fentanyl is addiction is a very challenging disease. It requires approaches from many different angles to cure it, to treat it, to work with it. Fentanyl in particular is a really dangerous drug, and when it's used, it can cause serious harm and even death in any amount.
I'm a big proponent of harm reduction, which means that we don't stigmatize, we don't punish drug users. We try to educate them first and help them use more safely. Ideally, people wouldn't be using bad drugs like fentanyl at all. It's almost impossible to measure it safely, but if they are, we need to make sure they have Narcan available, and for addicted users, we need to make sure there's a variety of medical assisted treatments available. We've got the drugs out there to help people, we just need to make sure people are getting them.
The people suffering from these addictions are people like you and me, And it can happen to anyone. It's our loved ones, it's our neighbors, our friends, our family, our coworkers. And to really try to decrease that stigma that's out there against drug use. And I think that would be a great step towards helping this problem.
I think the main takeaway from the conference is that everybody can do something to address this issue. Everybody should have the Colorado Crisis Hotline phone number in their phones and be prepared to call that number either for yourself, for a loved one, for someone you care about, for a coworker. It could be anybody. So in the same way that everybody has a role in addressing this issue, it could affect anybody as well.
Stay elevated by subscribing to the city's YouTube page for these stories and more. And stay tuned to our social media channels for more content. Don't miss our new episodes of Elevating Denver, premiering each month. Thanks for watching, Denver.